So something that actually didn't come out in 2020, it came out in September of 2019, but it kind of rolled out and became available widely in the US is Nubeqa. So can you explain what Nubeqa is and also how it's affected the prostate cancer landscape?
So second generation hormone treatments like Zytiga, Xtandi, Erleada, and Nubeqa, now Nubeqa, are game-changing agents. When prostate cancer becomes hormone resistant, often it's because the cancer cells have learned how to make their own testosterone, a rather frightening proposition. And these medicines block the activity of the testosterone inside the cancer cell instead of medicines like Lupron that just stop testosterone production in the testicles. And Nubeqa is the fourth second generation agent that we have. I named them already: Zytiga, Erleada, Xtandi, and now Nubeqa. Nubeqa is an interesting medicine because it appears to have fewer side effects than the other three, and it seems to have fewer interactions with other medications. Sometimes when you give Zytiga or Xtandi, you have to be careful if people are on blood thinners or blood pressure medicines and things like that. So the medicine, which is only narrowly approved for men with rising PSA on Lupron, is a convenient, attractive agent, possibly for broader use. And insurance companies may push back on that because these medicines are expensive. But it is an attractive option, in particular for someone that's already on blood thinners that can't take Xtandi or Zytiga. Nubeqa would be a good option for them.
So you mentioned less side effects. Is one of those lesser side effects fatigue? Because I know that's a huge issue in a lot of these other drugs.
So Xtandi's been the most popular agent. It's convenient and it is very effective, but about 25 or 30% of men get a very profound fatigue associated with it. Some men have to stop the medicine. And so the darolutamide would be a good substitute for people that encounter that problem.
In regards to kind of thinking outside the box, I mean, we understand that Nubeqa has a very narrow approval as far as where we're at in the staging, but is there any other way that a medical oncologist could use Nubeqa in other stages? Yeah,
it would be considered off-label, and then the real issue is getting insurance coverage. You can prescribe it at any stage of prostate cancer, and the insurance companies are very inconsistent in terms of what they will cover and what they won't cover. So doctors can order it, and possibly the insurance companies will pay for it for different stages, and in other cases they'll be pushed back, and you may have to make specific petitions if they can't take Xtandi, for example. But that is more of a logistics issue. It's not really a medical issue.
Would there be an added benefit for somebody who could afford to afford to pay for Nubeqa? Would there be a much better added benefit for taking Nubeqa earlier?
Well, only if this, for example, with the side effects of Xtandi, we talked about fatigue. Zytiga sometimes has some other drug interactions, fluid retention in people with weak hearts. It can change potassium levels and whatnot, occasionally causes liver problems. So in people that are experiencing these kinds of side effects, Nubeqa is a great alternative.
Thank you so much for watching. If you would like more information, you can visit our website at pcri.org. Also, subscribe to our YouTube channel. We come out with new prostate cancer videos every week.